Back with the Rocket Right Show. I'm Dr. Kay Solar in the house with Hurricane Betsy Barnes. And our medical segment is brought to you each week by Mary Bird Perkins, Our Lady of the Lake Cancer Center. And today we were talking with Dr. Tara Jarreau, who is a Cardio-Oncology clinic lead doc at Mary Bird Perkins, Our Lady of the Lake Cancer Center. And I understand that is a very new position.
Yes, it is. Thank you all very much for having me here.
Sure. So I want you to just kind of talk a little bit about, what that is and what was your background prior to being the lead on the Cardio-Oncology clinic.
So I'm a general cardiologist with training in advanced cardiac imaging. So I've been the director of the cardiac MRI program since 2013. So that imaging background kind of put me in the position, as well as my interest in preventative cardiology, to take over the Cardiology-Oncology program. So what the Cardiology-Oncology program is it's a collaboration between cardiologists and oncologists to help treat and prevent heart disease that may arise as complications of cancer treatments. So cancer patients are living longer than they've ever been before. There's new chemotherapies that are coming out, but a lot of them are cardiotoxic, both acutely and then later on, 10, 15 years down the road, when they're cured of their cancer and they forget about it, they later develop heart disease. So my job is to identify the risk factors and try to do what we can to prevent that from happening.
Yeah, let's talk about that a little bit more. So you were in the cardiology group at the Lake.
Correct.
This is a new position being over this clinic, although we've talked about the clinic on here, and a lot of people don't realize all the different side effects that can happen with chemo or radiation treatment to cure these cancers. And so let's talk about some of, you mentioned there's side effects on the heart that can be acute or even down the road. What are some of those specifically that folks, it might ring a bell or make them think about?
So when we think of chemotherapy, cardiac toxic drugs, we think of adriamycin. So one of the major chemotherapy agents used to treat breast cancer. That is very cardiotoxic, and it can be anything from a little bit of heart failure to florid heart failure going on to need heart transplant. So it can be very serious. And so same thing with radiation therapy. The radiation to the chest, whether it's for a Hodgkin's lymphoma where it's direct radiation, or breast cancer where they try to make the angles to where they miss the heart, but it's the chest. And there's acute radiation toxicity, and then 10, 15 years down the road, they get premature coronary disease, they get valvular heart disease. So a lot of things that go into trying to figure out who's going to have it and what can we do to limit complications that could happen later. Right.
So what are some of those factors? I mean, is there somebody that you see a person in the clinic and you go, that person may have a greater risk than this other person, or is it just random?
No, it's not. There are a lot of risk factors that play a part. Having underlying high blood pressure to begin with, high cholesterol, having heart disease to begin with. So a lot of these cancers are in the older population maybe they've had heart attacks, maybe they've had bypass surgery. And so those people we definitely need to get a close eye on. And then, your smokers are more likely to have cardiac complications related to chemo.
Well, it also seems if you're overweight or if you are pre-diabetic or diabetic, that would feed into it as well.
Correct.
But also the stress of the diagnosis would be, it seems it would add to the issues.
Absolutely. So if we could get control of the modifiable risk factors as they go into chemotherapy, hopefully they can have a better outcome and less risk of cardiac toxicities.
And I think that's great because there's so much focus on, you have this cancer, this is our treatment, regimen that we're recommending, but a lot of times we forget about all of those side effects and, like you said, pools of populations that are at greater risk for it. But I'm assuming also it's a potential for anyone to have those cardiotoxicities.
We have young patients that have nothing wrong with them that, because of the dose of whatever chemotherapy agent they have, it's bad for the heart. And, there's bad complications. And so, for some of the high-risk therapies, we do surveillance echoes, so ultrasounds of the heart to look at the cardiac function, both at baseline and throughout treatment. And we can, get early signs of damage and then maybe dose adjust or start patients on medicines that will potentially prevent worsening heart failure. And so that's what we do in the Cardio-Oncology clinic. So it's a new subspecialty in cardiology to where you have to have a little more knowledge on some of these side effects and what we can do to prevent that, which is new because, like I said, the immunotherapy, like that was mentioned earlier,
right.
That's a new thing, and that's helping a lot of these stage 4 cancer patients live a long time, but it can cause toxicities in the heart, myocarditis, and things like that.
And some of the work that you're doing and some of the results that you're finding could help people in other parts of the country, because Mary Bird Perkins does share so much information with other cancer treatment facilities. I mean, it's really life-saving.
Yes.
So what do you find when you're talking to some of the patients and they're just really trying to deal with the cancer diagnosis, and then you have to point out that their high blood pressure needs to get under better control, or they have abnormal cholesterol, or they have diabetes, as Betsy mentioned, and to have a less chance of complications and to have your long-term success? Do you find that a lot of the patients are just so overwhelmed with dealing with the diagnosis of cancer and getting through that? Or do you feel like a lot of the patients are so glad that that is brought up and they're very, I guess, you've got to be personally driven for that, because sometimes you're just beaten down with that diagnosis. Are they personally driven to make those changes to lessen their chance for side effects?
So, yeah, I think a lot of once you get involved into a chemotherapy regimen or radiation therapy regimen, you're committed to your health. And so most of these cancer patients are going to be the most compliant patients you'll ever see. They want to do whatever they can to survive their cancer and, not have adverse cardiac events. And so having the two married together is better for the patient.
Absolutely. Now, is there signs or symptoms that some of the patients need that you counsel them to look out for?
Absolutely.
Other than, the screening and preventive, like you're talking, but things that if they were having a particular treatment, they need to sound the alarm to contact that it could be a
absolutely.
cardiac.
So, for instance, just recently we saw a patient in clinic and we saw that her heart function had started to decline a little, but not bad enough to have to stop therapy. So, I explained to her things to look out for. If all of a sudden you feel like you can't breathe, or you have lower extremity swelling, or you can't lay down at night, or the things that you used to be able to do exercise-wise, and you can no longer, that's something you need to bring to the attention of, your oncologist, and so they can look out for that. So,
yeah. Now, do you find that, because she said, some of these side effects come out, people are living longer, their cancers are getting cured, 10, 15 years down the road, some of these medicines, I've kicked it, I don't really want to see the doctor again, they're like, forget about it. What is the type of surveillance for particular ones that they need to do that? It sounds like it hadn't really been done in the past.
Well, they just recently came out with guidelines, the consensus guidelines on what you should do, and that serial ultrasounds of the heart to monitor function, and depending on age and risk factors, potentially stress test, and being really aggressive with cholesterol control and preventing coronary disease and things like that. So there are, and we have a lot of data from the childhood cancers, and they started seeing that people are surviving childhood cancers, but then they're dying of heart disease way younger. And so what can we do even as a child, starting that screening early and getting them plugged in with the right people. So.
Yeah, especially like you mentioned, the Hodgkin's, that's frequently a young cancer. Well, let's find out just a little bit about you, because we always like to delve into the personal thing. Are you a Louisiana girl originally?
Absolutely. I grew up in New Roads across the river, small town girl, and I went to LSU undergraduate and then off to medical school, and Katrina hit in my last year of medical school when it came time for the match to figure out where you're going to go for residency. So I ended up doing my internship at Newark Beth Israel in New Jersey. And then I transferred back the next year after LSU. New Orleans had revived itself.
Right.
And I did internal medicine at LSU in New Orleans, and then I went on to cardiology fellowship at Ochsner. So, and then ended up back in Baton Rouge.
People in New Jersey must have loved your accent.
They did. They did. And remember, it was post-Katrina, so I was like famous. Everyone's like, tell us about the hurricane. Yeah.
I know your family's so happy that you're back and close to home.
Absolutely.
And there's probably a lot of people that are patients of yours that you probably know are referred by family.
Absolutely.
And
I have an actual clinic in New Roads, and it's, I see family and friends, bus drivers, high school teachers. So it's very good. And they all call me
awesome.
Dr. Tara because, you know,
Yeah.
they've
Well,
known
that's
me since I was 5.
That's awesome.
But you've
I
earned
always
it.
liked
Yes,
that.
absolutely.
I mean, you know,
Yeah.
patients call me Dr. K, but that was just to distinguish me from my husband, Dr. Curtis.
Right.
But I liked it. It just felt more connected
Right.
and personal. But so we have been talking with Dr. Tara Jarreau, and with the Cardio-Oncology Clinic. You can go to marybirdlake.org/medical-oncology. Is that the best place to find out more information?
Absolutely. There's a website. Talk to your oncologist about referrals if needed, and we'll be happy to see you.
Well, thank you so much for taking the time out of your busy day and joining us tonight. Yeah.
Thank you very much for having me.
Well, and we hope you'll come back as you get more information.
I would love to.
Sure, we'd love for you to. And up next, we're going to talk a little bit about our 6th anniversary on radio.
Crazy.
That's right, and our 1-year anniversary on television. So hang with us, and we're going to have a lot of fun.